Hi guys, welcome back to the quarters. Today I have my friend. This one, she's my real friend. Some of the people they are not my friends, but this one is my real friend. Yeah. I have with me
Ophelia, Boma. Nice to meet you all.
Yeah, and she's also a YouTuber. So please, I will put her channel link in the description box. Please make sure you go and subscribe to. She even has 2 channels. Go and subscribe. And the reason why I brought her today is not because of YouTube, but we'll get right into the video after you have generously subscribed to the channel and like this video. Have you liked it? Thank you.
Thank
you. So let's get right into the video. So Ophelia, thank you so much for coming to the channel today. Would you like to introduce yourself?
Yes, sure. I would like to say a few words about me. I'm Ophelia Boma Azure. I'm a clinical health psychologist and I'm a school counselor.
Okay.
I like to advocate for mental health policies and activities or programs that will help the ordinary Ghanaian to navigate through life. Okay. Yes, and so during my part-time, I also make videos on YouTube as well.
It's not part-time, it's your main husband. Okay. Thank you, Ophelia, for coming to the channel.
Same here.
Let me tell you guys how I actually know Ophelia.
Okay.
So I think it was 2020. Was it 2023 or 2024? 2023.
That's where we met.
Yes. Yes. So I'll go and look for the date and I'll post it there. But I went for an event, a mental health event. My friend Adole told me we should attend at Nancy Library. I did not know God was orchestrating for me to meet the wonderful Ophelia. So when I went for the event, they had these booths where psychologists, you could speak to them, therapists to them for free. You don't have to pay anything. And I kept saying, wonderful events like this, why didn't people come?
Yes.
And me, that day, I didn't want to talk to any psychologist. Because,
oh, really? You didn't want to?
Yes. I think when I entered, I told you that I didn't want to come. The people kept forcing us to go and talk. Not like forcing, but it's like, oh, we have psychologists. Don't you want to talk? I'm like, no, I don't want to talk to someone because I've talked about my situation, so I'm tired.
Yes, I remember you said that.
Yes. So I don't even know how it happened that I ended up at your booth because I think I wanted to speak to someone I already knew. Then that person was not available, so I think I ended up at your booth. When I entered, hey, this pretty lady with pretty hair. I say, who is this? So I told her, look, please, I'm unemployed. My relationship has ended.
I remember.
Everything's a mess, but you know what? I have a mental health condition, so I know the drill. So ask me the questions. Okay, I didn't say that, but it's like as I was sitting there, it's like, please, I know you and your mates and all that you do. This, you always sit down, you listen, and then you ask the questions. And then she was so nice, so kind, such a good listener.
Thank you.
And by the time I left, I didn't regret. I took her number. I said, this lady is nice. Then I went to listen to her at the panel discussion. She spoke so many words of wisdom. And what intrigued me was, you never told me you were a YouTuber. Like, instead of her to say, oh, you do YouTube, but I told her,
yes, and I even subscribed.
Yes, she just, quietly, she just subscribed. She never said, please, me too. I'm a YouTuber, I'll collect my channel. I was like, this lady is very humble, like low key. So I think when I started watching on status, I'm like, hey, so you're a YouTuber. So since then, we have been friends.
Yes.
And one thing I love about Ophelia is she is also a serious mental health advocate. Like she's a celeb. She's everywhere. So if you've not seen Ophelia,
mental health model.
Yeah, she's one of those people, and I'm really proud of all the work you do because it makes our voices get louder. So today we are here because Ophelia is a psychologist. You are the second psychologist I'm bringing to my channel.
Oh, nice.
Yes, my first psychologist, Dr. May. I made her come and talk about our first encounter, and I'm really proud of all the work you do because it makes our voices get louder. So today we are here because Ophelia is a psychologist. You are the second psychologist I'm bringing to my channel. Yes, my first psychologist, Dr. May. I made her come and talk about our first encounter, and like our journey together, my road to recovery and all of that.
So it's always been lived experience.
Yes,
Okay.
yes. So, but today I'm bringing you as a professional,
nice. Yes,
to come and tell us, like, so my first question is, people say therapy, like a therapist and a psychologist. What's the difference?
Therapist and
And
a
a psychologist, yes.
Okay, so the difference is the limitations of our work,
Okay.
right? Even though we kind of like do similar things, sometimes it may mean the same word for the same profession.
Okay.
So psychotherapist is more also like a counselor, but they are sometimes limited because clinical psychologists do more work of the clinical examination, assessment, examination. I'm sorry, I've mentioned examinations already. So assessment, examinations, and then other activities to investigate about the clinical diagnosis.
Okay.
And it follows up with therapy as well. However, with the psychotherapists, they are also limited with the clinical stuff of counseling. So at the end of the day, we kind of like do the same, but just the limitations of different activities in coining out or solving mental health therapies and things.
Okay.
Yeah.
The reason why I'm asking is, when I was newly diagnosed, I used to see my psychologist all the time. But I realized when I watch movies, people say, I'm going to my therapist, I'm going to my therapist. I never used to hear anybody saying, I'm going to my psychologist.
Yeah.
So I always used to wonder, but now that you have explained, I understand. And sometimes people even get confused, like, who is a psychologist? Who is a psychiatrist? So sometimes I just tell them that psychiatrists, they have like the license to know, prescribe medication, but psychologists don't do that.
Prescribe.
Well, I'm lying.
True. No, that's right. You're right.
Yes.
You're
So
right.
you see, I'm
Some
experienced.
psychologists prescribe, but here in Ghana, we do not prescribe. But in the States, some psychologists prescribe medication. Yeah. So someone like Dr. Newman Atta can prescribe medication because he is also a doctor. Someone like Dr. Erica Dixon at 37 Military Hospital can diagnose and then prescribe.
Because she's a medical doctor.
Yes, she's a medical doctor. But we, in clinical health psychology, we also learn pharmacology, but we are limited here in Ghana.
Okay. It makes a lot of sense.
Yes.
So people may be wondering, when do you need therapy?
Okay. So the word therapy, I just want to explain the word therapy.
Yes.
So therapy, in a layman's sense, is an activity that helps one to navigate their life. Okay. So if you have a need that there is something happening in your life at this current moment and you need the help or a support of someone to help you understand and manage it, that is therapy. So therapy doesn't just cut deeper into clinical aspects, but everyday life with a friend. So sometimes you have a need, you have boyfriend issue, and you can tell your friend. All of that is therapy. At workplace, if you have an issue and you inform your boss, a supportive boss, not someone who would, I know we spoke about this earlier. A supportive boss who will take you through one or two words of advice or suggestion is also offering therapy. So when you come to the psychological aspect of therapy, we go deeper into understanding the root cause of why you need the help and why this is even happening. So at the end of the day, that is why we have to do the assessment, the analysis, examinations, to understand why you are going through what you are going through and how best we can help you. Then the sessions that follow after the examination is the therapy. So there are different forms of therapy that helps one in whatever mental health challenges that they go through. I've mentioned some few aspects of therapy, right? How one-on-one people can advise you and make suggestions. But when you come to the clinical aspect, there are many things that affect people. Number one, their physical health. Okay, so a physical health is when you have constant headache, right? Where you don't know why, like you are not sick, but you continuously have constant headache. Or maybe you may have body pains, like you don't know why. And sometimes people go for massage. So that's why we call it massage therapy.
Yeah.
I don't know if you've heard
I've heard of
that.
it.
Good. Then we have music therapy and art therapy. So these are various forms of therapy that help people, because sometimes your body can suggest what it needs to help you live or manage your life in whatever way that will help you to be a happy person. Then let's go to emotional, right? So emotionally, people are battled with a whole lot, right? So when I say emotional, it cuts deeper into your mental stability. If there's anything that you're going through that is causing you emotional pain or burden or unresolved traumas, right, then you need the therapy to help you to manage those kind of traumas. And then psychological as well. So the psychological is more of your cognition, how you think, how you understand things, your perception of life, or even your understanding of the world. All of these things can affect us. Our confusion, growing up in a certain environment, can inform our understanding to what life is. And so if you grow up from a certain environment that now affects your understanding to life, you will need therapy to understand yourself, like your personal identity, your values, your beliefs. So it cuts across why people need therapy. A layman will say, number one, people with even time management, mismanagement, would need therapy to manage their time. Anger issues. If you know that you're someone who cannot manage your anger, you need therapy to manage it, right? If you have family problems, like parental issues, or even you as a teenager or a young adult who cannot get along with your family, you need therapy to understand that. So therapy goes deeper and deeper, and it involves our whole life as well. So everyone needs therapy.
Yeah, everybody needs therapy, but people have this perception that you only go for therapy when things are bad. I mean, you are fine, everything is going on well. If you are fine and everything is going on well, and you are going for therapy, people don't understand why are you going for therapy.
Oh no, for therapy, like I said, if you have a friend, you speak about things, and this is daily therapy. Is a cause of the limitation of people's understanding to mental health and therapy. But every day, the friends that you speak with, the friends that make you happy, the music that make you happy, the dresses you wear that is all therapy. Okay, but it's because of the stigma to go into a professional's office to seek for more knowledge and understanding. That is why people refrain from really accessing clinical therapy, except that everyone needs therapy. For example, personality traits. Like you need to understand your personality, your strengths, your weaknesses, so that you can. I mean, there's a saying that to the person who knows him or herself has the power to conquer. If I know of my strengths and weaknesses and I find myself in any environment, I have the ability or the stability to be better of myself. Some people can just go to therapy to get to learn how to cope, like to learn of coping strategies or coping techniques, or even how to manage stress. Right, maybe I find myself in a new working environment and I need to be flexible, or I need to adapt. How can I adapt to this environment? The person doesn't have to be sick or doesn't have to have mental health challenges before they come for therapy. No.
So can children go for therapy?
Yes. So therapy cuts across all walks of life, age, background, skin color, or race, or gender, or sex. Please, therapy is for everyone. And with children, we have what we call the play therapy. So the way the children play is a form of therapy for them. And I mentioned the art therapy, like the drawing, coloring. I think you've even seen some drawing on my status.
Yes,
and coloring. Yes. All of that, it's more of when adults do it, we try to bring out we call it the inner child in us, right? There is one called the stress ball. I don't know. You've seen it before. Or the slime. You find some adults playing with slime, and children also play with slime. So all of these things act as what? Therapy. Even the phone we are using is therapy. When children are playing with phone, we say, oh, these children, they like the phone so much, but it's because of the connection they get from it. That is why, like, it suits them, you see. So anything that suits you is more of a what? Therapy. But I'm not talking about the negative things.
Because some people will definitely have their negative. I mean, everything has its good and a bad, but I think therapy in all, it is very good. Yes. So what made you decide to become a psychologist?
Wow.
Because me, I had never heard about that profession before. Till I was diagnosed and I found out that I had to start seeing somebody called a psychologist and a psychiatrist. I didn't know. So how did you end up becoming a psychologist?
That's a good question. You see, sometimes when I get questions like this, I really find it difficult to pinpoint one thing
that
made me become a psychologist. There are different factors. Growing up in a neighborhood where there was not much spoken about mental health, but we saw people with the physical mental health disorders. An example is the full remission or the severe mental health diagnosis, like schizophrenia, right, or the psychotic disorders, right, psychotic disorders. It was so bad because you see these people and they look different from us, and you try to understand why are they like this, like how can I understand them better. So as a growing up child, I always wanted to understand them better. I wanted to understand how they think, like why they are the way they are. But I didn't even know in future I would be pursuing a program or a profession like this. Then after school and everything, one of my closest friends, which I can't mention her name, a friend we used to play together as kids, was later diagnosed of a mental health disorder as well. And like I said, the confusion was huge. How can I understand her? How can I help her? How can I still be her friend and be a better friend? That also affected my understanding, and then the need to pursue mental health. Then after the university, I went back home to the Upper East, to Bolgatanga, right? And I was working with children. So as I was working with children, there were certain needs I could not fulfill. Yes, there were certain needs I could not fulfill. And I realized that the need that could help me understand them was to understand the psychology behind childhood, right? So by then I had read a lot, and I realized that I could also become a psychologist. And I started reading about it online, how to pursue it online. And I was also praying, like, I'm a I'm a prayerful girl as well, right? So through the prayers, I think God was also nurturing me to this direction. Like, go and read clinical psychology, because my twin sister had pursued her master's, and I was still sitting at home. I said I want to pursue master's in clinical health psychology. If I don't, I'm not going to school.
But what did you do for your undergrad?
And public health.
Oh, okay.
I did public health. And so she went her first year, I was still at home. Second year, I was still at home. Right. But I was still working, right? And I just felt a strong faith in me that this was what I was supposed to do.
The work you were doing was not related to psychology?
No, it was not related to psychology. It was because I was working with kids. And I wanted to understand them better. Like the unspoken words, the hidden emotions and feelings. Like when God puts something in you, He finds a way to bring it out. Like there's always meaning and purpose attached to the things we don't even know about ourselves. Right? So I felt connected to that. Yeah. So I applied to Cape Coast University, and And in fact, the reason why I got into this course was because I mentioned I worked with kids.
Oh, okay.
And the magical thing was that when I had completed my my national service, I was supposed to come to Accra. And if I had come to Accra, I wouldn't have had the opportunity to work with kids. So I stayed back. And my friends used to say, what are you in Bolga for? Like, you understand, like, really, there's nothing really going on in Bolga, because Accra is a rush hour place. Yeah. Bolga, when you wake up, you are being fed, you are spoon fed, right? So it was more like, don't you want life? Like, come to Accra. But I felt deep within me that I needed to stay in Bolga. And as I worked with these kids, that was the reason why I was accepted to do this course.
Okay.
Right. Yeah. So the reason why I couldn't go the first and second year was because I didn't have a background in psychology.
Okay.
Yes, but I have topped up with a certificate in psychology from the University of Methodist University.
Okay.
Yes. So now I have a background in psychology.
Okay. Okay.
Yes.
So those who want to be psychologists.
Yes.
It's not too late. You can go back.
Yes, you can. You need a master's and then the certificate in psychology. So if you don't have the psychology background, you need a master's, you need a certificate in psychology, and then you need an internship, a 1-year internship. Then you can become a psychologist.
Okay. Yes. So I don't know, in Ghana, is it possible to, maybe you are choosing a psychologist or a therapist and you want to make a change? Is it allowed?
Yes.
Because some people think if they are seeing this particular doctor, I'm stuck with this person for life.
No. Sometimes, like any form of medical discipline, okay, there are also personalities behind the profession.
Yeah.
Do you get? You can meet a psychologist, you vibe, the person gets you, and you know, I've been seen, I'm being heard, I'm being understood. Like, she gets me or he gets me. And so you see that the therapy session goes smoothly. Okay, you would always want to do your best.
Yeah.
But there are other doctors or even a psychologist you meet and like,
no. They don't get me. They don't see me.
They don't see me. The way I want to be understood, I'm not being understood like that. Okay. And when it is like that, it's not the fault of the psychologist, it's not the fault of the patient or the consumer, or the client, right? It's just because there are certain energies behind people. So when people get you, they get you. When they don't get you, they don't get you. Right? And then it comes with a certain form of withdrawal when you're working with somebody who doesn't understand you. Right? And in psychology or in other health terms, we call it culturally competent services. Somebody who is delivering health services to you and who gets you. Okay. An example is when they bring an Ashanti to Bolga to work. Definitely there'll be language barrier, traditional barrier, culture, everything. You get what I mean? And so sometimes I meet clients because I cannot speak the tree properly. I can't vibe with them. This does not mean that they can't change. I'll even be the person to do the referral for you to go and meet a psychologist who understands tree or ga or ewe, somebody who can, transcribe the English language into your local dialect for you to understand. So it's not about expertise, it's about somebody who really gets you and you know that this person understands me and can really help me. So yes, you can change a doctor or a psychologist at whatever point. And normally when you even start therapy, all these are rights there, it has to be read to you. You can change.
Can request for
change. Even if you're taking medication and you find that maybe this medication is not doing well for me, you can go back for a review and it will be changed. So there is no strict structure for mental health services. No.
So where can people find a psychologist or a therapist in Ghana?
Psychologist or therapist, well, there are some online now, there are some, because of the tele mental health services, there are some online now. If you Google mental health professional in Ghana, they may link you to one person who has is social media profile.
Yeah.
That is to those who have social media profiles.
Like you.
Like me, yes. But to those who do not have, most of the generalized hospitals or public hospitals and some private hospitals here in Ghana has. If you're located in a rural area in Ghana, I'm really sorry because there are very limited number of mental health professionals in Ghana. So you may have to opt for the tele or online therapy services. So in Accra here, there are a lot. 37 Reach, Osutras Hospital, UGMC. Like you find almost 2 or 3 or even 4. Yeah, but if you go to my hometown like this, you may not get even 1.
Yeah, they are limited in number. So, therapy sessions can cost as low as how much?
200, 250, especially for the public hospitals like 37. They even go with the insurance. And other hospitals to go with insurance. Others are cash and carry. For the private hospitals, it's cash and carry. Or even if you have the insurance, like your work has a very good insurance, you are covered. Very so you. I don't know, but if you are taking up a new job, you should always ask if they have your mental health services covered. So it should be like there should be a portion to your mental health, basically, than your biological health, right? Because there are some people a whole year don't fall sick, okay, except maybe going for checkup. But for your mental health, you may need it. There are a lot of times you are stressed. There are a lot of times things are going, maybe there's even grief when someone dies and you need grief counseling, or trauma, you got a heartbreak or disappointment, not only from boyfriends but even in life
in
general life challenges. You may be disappointed one way or the other, or even what we call, what's the name, financial losses. You know, you may lose some money, yes, bad investments, yeah, and then you'll be heartbroken and you need counseling for that. So always make sure that your mental health insurance, no, your medical insurance covers mental health.
Okay, so you said as low as 250.
Yes.
And as high as how much?
500, 800. There are some private hospitals here who take 1,000 cedis a session.
So if I'm going for 1,000 cedis a session, are there some, I don't know, perks or privileges or something that comes with the service?
It is sometimes the bill come with the structure of the hospital or the facility, right? There are some facility you can't compare 37 to Accra. What's the name?
Accra Psychiatry.
No, not Accra Psychiatry. When you are going to, it's opposite Ghana Police, the CID, the headquarters, the police headquarters.
I've seen that hospital, Accra Medical Center.
Yes, also. Accra Medical. You see, it's a very polished or posh environment, right? You go there, is AC, there's lighting, it smells nice, the environment is so soothing. You see, and there's like the equipment there helps you to get better. For example, if you're doing progressive muscle relaxation, there's a space, there's a therapy bed.
Okay.
Do you get what I mean? There's a therapy bed. So it comes with the services or the structure of the hospital. So you can't compare that to say 37 because the space is even small, or even police hospital. The space is so small. So they can't do as much as even though they are qualified and professional, they may not be able to carry out because the space does not offer the opportunity to do that. And so definitely the price will come down. And there are also home services as well.
Oh, so you can request for a therapist come and see you at home?
At home, yes. Yes, you can do that for your privacy sake. You can do that.
Okay. So when people always make these statements, my therapist said this, my therapist said that, like, it's like now they are imposing therapy on people. What do you think about all of that?
Like, you find yourself in the midst of people always saying, my therapist said this, my therapist
some people can do that. Like, let's say, oh, my therapist said that I should, avoid narcissistic people. It's that kind of thing. Oh, I learned this in therapy last week. That kind of thing. What do you think about all that?
I think it's the advocacy. The advocacy to promote mental health, understanding, and to debunk certain stereotypes or myths about. Like I said, the reason you ask, how do you know you need to go and see a therapist, or if you need therapy? Sometimes for personal growth.
Yes, it's true.
You see, so for someone
sometimes
like
people think it's always the bad.
No, not at all.
Yeah, it's
okay.
True.
So the person has learned something, and the ability to unlearn and then relearn something is the growth of life. So they are amused by it, and so they come out and say, "Oh, my therapist said this, my therapist said that." It's just like saying, "My mother said this, my mother said that." It's because the person has value attached to that. That is why they are saying it out loud. So it's not supposed to be a threat to other people. It's rather supposed to encourage common conversations and then understanding around mental health and therapy and all of that. And for me, I think I love people who have the ability to accept who they are at every stage in life. Like to not really feel left out, but to make it a point to be part of something, whether with their friends or at their workplace, or like you should own up to it. It's your story. It's your story.
So do you have any final words? I know it has come so quickly.
Yes. Well, final words to those that are watching me right now. Basically, mental health is how we feel, how we think, how we behave. All right. So right now, as you're watching, I know you are also having behind the scenes thoughts about certain things you have gone through in life and you don't even understand. Sometimes this could be childhood challenges you went through that you have maybe disassociated from, but they keep coming back, and then they cause some pauses in your life, right? Do yourself the good and just see somebody who understands this, because that is the psychology of life, right? If you have an issue with your roof, you call a carpenter.
It's true.
If it is your water or pipeline, you call the plumber. Now, if it's something that has to do with your brain or your mind, you need a psychologist to really come and help you understand who you are. And I'm one thing positive about Ghanaians, that they like to learn, but they don't want to be diagnosed or to be associated with mental health, right? They want to be told, you are feeling this way because your mind understands this way, and that is why you are reacting or behaving it out like this. But they don't want to be told, oh, maybe this could be a suspected depression. They fear that.
God forbid.
Hey, how did you know?
I reject it to the name of Jesus.
Yeah, so in short, you need to take your mental health seriously, because mental health is also related to spirituality. Okay, if your mind is not at peace, it means you don't also have spiritual balance. All right. So this is all what I have to tell you. And then whatever it is, you can reach me online on my social media platforms.
I'll put it in the description box.
Make sure to follow, like, subscribe. And sometimes we need the engagement. Just text and ask questions, like something.
I'll advise you. Please,
this advice
next half of the year, ask questions, because sometimes when you ask questions, you give us ideas about what we should come and talk about next.
That's true.
So Ophelia, thank you so much for coming to my channel. Thank you for sharing your expertise with us, and I hope that people will watch this video and now have a new mindset about therapy. Because therapy is not for people think, oh, if you want to start seeing a therapist, you have a mental health condition.
Please, no.
Like she said, even for personal growth. Okay, so also you can also do Jesus and do therapy.
Yes, you can do both.
Yes. So
Yes.
the fact that you're Christian doesn't mean you shouldn't go and see a therapist.
No, no, no. You have to. In fact, that will even make you more powerful.
Yeah.
If you have mental balance and spiritual balance, it makes you a powerful person.
Very true.
Yes.
Very true. So we'll see you again in another video.
Yes.
Bye from the
Bye.
quarters.
Bye.
Bye.